Good afternoon, distinguished chairman, distinguished Professor Hu Dai, Professor Zhu Hill, ladies and gentlemen. I'm Liu from the First Affiliated Hospital, Harbin Medical University. And the topic for me is cardiovascular medicine in China, opportunity and challenge. This is epidemiological data from the 2022 China Health Statistics Yearbooks. We can see that cardiovascular disease is the leading cause of death in China. In 2020, exceed the death rate of tumor. So really a big problem, and we can see that the prevalence of hypertension in China is about 25%. That means about 350 million hypertension patients in China. So also we can see from this figure, since 2010, the prevalence of hypertension in China has slightly declined, but the treatment and control remain very relatively low. And a study from China showed that with doctor-led intervention significantly enhanced blood pressure control among rural hypertensive residents in China. So this gives us a feasible, effective, and sustainable implementation strategy. And the strategy may be scaled up in low and middle income countries for hypertension control. And recent years, the renal intervention as technique is relatively popular in China, and many domestic products already being used in clinical practice. Like this one, this is the basket light 6-electrode radiofrequency system, and this kind of mapping system so already being used in clinical practice for the treatment of hypertension patients. But for the cryoablation, the ultrasound renal denervation system, and this kind of mapping system still in preclinical practice period. And this is data from China showed that this kind of domestic renal denervation system called BioHeart is very effective in treating the hypertension, and the system could be used via transradial approach. And as to the pulmonary hypertension, the data show that pulmonary hypertension prevalence is about 1% of the global population, which increased up to 10% in individuals aged more than 65 years old. And in China, we all know that Professor Chen Shaoliang invented a novel system to do the pulmonary artery denervation, and this is a special shaped the apparatus could be used to ablate the pulmonary artery sympathetic nerve, and the theory is at the left side of the main pulmonary artery bifurcation, the sympathetic nerve trunk is less than 1 millimeter from the arterial lumen. And the study from Professor Chen showed that in patients with group 1 pulmonary hypertension, the PDN technique could improve exercise capacity, hemodynamic status, and clinical outcomes during 6 months follow-up. And this is PDN5 trial, and so even for the pulmonary hypertension patients secondary to the left heart failure, that means the group 2 pulmonary hypertension patients also could benefit from this pulmonary artery sympathetic nerve ablation technique. And this is a study by my team, and we use a special technique, the cyberknife technique. We all know that cyberknife is a radiotherapy for the cancer, and we use a cyberknife to ablate the pulmonary artery sympathetic nerve in the kidney model, and we found that could reduce mean pulmonary artery pressure, the pulmonary capillary wide pressure, and the pulmonary vessel resistance, and increase cardiac output in acute kidney model. But the use of this technique still need the clinical evidence. And as we know that ischemic heart disease had the highest aged standardized mortality of all disease, and in China last year already more than 1.6 million PCI cases in China, so very large, huge number. And the data showed that in patients with, if the patient only use angiography guided PCI, only 24% could got optimal revascularization. And a study from Professor Chen Shaoliang showed that in ACS patients, IVAS guided PCI could result in a lower 1-year rate of the composite outcome by 45%. And we all know the fever. This is the flavor study. Flavor study also come from China, and flavor study showed that in patients with intermediate stenosis who are being evaluated for PCI, and IFFR guided PCI is non-inferior to the IVAS guide PCI, and in the IFFR group, the PCI rate is 44.4%, and in the IVAS guide group is 65.3%. So that means IFFR guided for this kind of cases showed great health economic significance. And figure 3 studies showed that QFR is a less traumatic and more comfortable physiological evaluation method, and this system already been used in routine clinical practice like in my center. But the limitation of QFR is the accuracy of QFR will be decreased in tortuous for resulting or overlapped segments. How to solve the problem? My team invented a novel system. We called it IFFR CT Angel. That the hybrid model is constructed based on CT angiography, and the CTA could help us to extract the central lines and precisely, and the CEG could provide accurate right eye. So with the help of the AI technique, we could precisely evaluate the function of the stenosis lesion, and this is the preliminary data of our team. We can see relative better than QFR, but we are still do a multi-center randomized clinical trial to testify the efficacy of this system. And our team also invented a novel system. I called it intelligent visualization system for coronary artery CT angiography. And I already used this system in many live demonstration cases, like last year in the 360 live demonstration. And for 3 months, I do live demonstration. And in each case, I use this kind of system. We can see this is the RCA-CTO lesion, and what we can got from the common CTA, just like this. But we can see this is the intelligent visualization system. The system, we can clearly see the plaque distribution, and where the brown one is the soft plaque, the white one is the calcified lesion, and we can delete any part of the structure, vessel structure, and we can enlarge, we can rotate, we can see from any angle view. So for this case, we can see also the calcified plaque is not very large, but in the distal cap, there is a very huge calcified lesion. That means if we use antiquate wiring technique, the antiquate wire in such point may go the wrong direction. And really, we can see the antegrade wire go to the wrong direction. We have to use the ipsilateral collateral channel to do the retrograde approach PCI, and finally successfully recanalize this case. This is a live demonstration case in the 360 MetaStream 360 program. And this is the final result. And use this system, we can clearly to see where the outstream of this kind of nose-tap CTO lesion, and very clearly the proximal cap is here. And also very useful in the calcified lesion, and just like in this left coronary artery, we can see severe calcification, but in the proximal portion, like in the ostium of the LAD, also there is a huge calcified lesion, but in the deep layer, and no need to do debulking. But in the proximal LAD, also the calcified plaque not very large, but tightly embrace the proximal LAD. So in the proximal LAD, we use ROTA and lithotripsy. This is the IVAS and OCT all-in-one machine, and in the shockwave balloon. And finally, this is the final result. And I won the case of the week in the live demonstration. And certainly, recent years with the use of the imaging-guided PCI, the de-escalation strategy already been widely accepted. And a study from Dr. Chen showed in patients with ACS plus DES and DEPT for 1 month, and ticagrelor alone may have a lower rate of clinical relevant bleeding and a similar rate of MACE rate compared with ticagrelor plus aspirin. So why? Because these studies are from my team, and we studies showed that maybe the East Asian people may be more sensitive to the ticagrelor. And we found that even 1/4 standard dose of ticagrelor provided a greater degree of platelet inhibition than common dose clopidogrel. And we did a superior study, and we found for the East Asian patients, ticagrelor, the standard dose once daily. So in this group, the therapeutic window was highest. That means maybe for the East Asian people, ticagrelor once daily is strong enough to inhibit the platelet. And certainly there are also some studies from China showed that indobufen could be a pharmacological alternative to aspirin in high bleeding risk patients who need DAPT. And colchicine also improves the coronary plaque stabilization at found by the OCT, the result. And as to the atrial fibrillation in China is about, the prevalence is about 1.6%. And really, just like Professor Zhu Hu said, in the cold area, the cardiovascular disease, the prevalence is very high, and so does the atrial fibrillation. And the data showed that extremely cold was associated with a 25% higher cumulative risk of atrial fibrillation episodes. But what's the reason? Not only because of the smoking, and our study showed that the cold may change the gut bacteria, and a kind of good bacteria, Akmansia, so the abundance is decreased significantly and may cause the blood level of TMO increased significantly and cause inflammation of the myocardium and may cause atrial fibrillation. And not only the adults in the cold area may have the increased risk of atrial fibrillation. So our study found even for the people, if he was born in winter, so when he adult, the atrial fibrillation risk increased. I used the UKB Bank and showed that risk increased about 46%. Why? Because the study showed that in the cold weather, a kind of good bacteria in the breast milk of the mother decrease. So may cause when the getting old, so all the system, the gut bacterial system changed and may cause inflammation of the myocardium, may cause the higher risk of atrial fibrillation. And certainly in China, so many probiotic strains are already being used in clinical practice. And this is Chinese consensus on fecal microbiota transplantation and use this technique to treat many kinds of disease. And also in some center in China, they use phage therapy for that kind of patients with pan-drug resistant bacteria. So for a few cases, very efficient for the treatment of this kind of very tough case. And this is a study from Professor Ma, so showed that a smaller heart may have higher risk of cardiovascular death and embolism and major bleeding in atrial fibrillation patients. And these are some studies showed the efficacy of Chinese traditional medicine. And another hot topic in China is cardio-oncology. And the first cardio-oncology diagnosis and treatment center was built in 2017 in Harbin. And there are also many association and committee already being established in China, like the Society of Integrated Cardio-Oncology of China Anti-Cancer Association, and I'm the president of this association. And last year we published the Cardiovascular Cardiovascular Protection Guideline. The purpose is not only to prevent and control cardiovascular injury caused by cancer or anti-cancer treatment. Another main purpose is to avoid unnecessary reduction or interruption of cancer control therapy due to cardiovascular reasons. We must try our best to tell the doctor in the treating the tumors to know the cardiac protection, certainly so in China we already have many high quality studies. Just now I just introduced some of these studies, but I do think we still need more high quality Chinese evidence. And in this year, GWICC and Professor Ma already set up the cardiovascular randomized control trial group. The purpose is to build a collaborative platform for cardiovascular disease clinical trials. And I do think in the near future, there are more high quality clinical trials in China and may achieve an inflection point of the decrease of the cardiovascular disease mortality. That's all. Thank you for your attention.